What's up? I'm Hutch, and you need to understand the cardiac cycle so that you can better educate your patients in cardiac rehab, and also pass the NPTE. In short, the cardiac cycle consists of atrial contraction and relaxation, and then ventricular contraction and relaxation. It's a pattern of contractions that makes up your heartbeat, and it's also called sinus rhythm because it's run by the sinoatrial node, and you can check out this previous video if you want a little refresher on that. This video also explains how an EKG works, which is the best way to get a picture of how your heart is functioning and how this cardiac cycle is running. In this graph, the first thing you'll see is the P wave. This represents atrial systole, aka S1, or the lub of lub-dub if you're auscultating for heart sounds. The PR interval is the time when signals are transferred from the SA to the AV node. The spike is called the QRS complex, which represents atrial diastole, and quickly thereafter ventricular systole, which is the S2 or the dub sound if you're auscultating. The return to baseline is sometimes known as the J point, and this is in the middle of the ST segment. If this baseline is elevated, it can indicate an acute myocardial infarction or heart attack, and you can use the mnemonic STEMI to help remember this. Finally, the T wave represents ventricular diastole. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. The P wave is the first portion on the EKG strip, and it represents atrial depolarization, also known as systole or contraction. Hopefully that covers all of our bases. If not, you can check out the description box below for a link to my notes, or you can comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying and go change the world.